Today, the response shifts to the borders, and Europe steps into the field picture for the first time. If you're just joining us, this started when Bundibugyo transmission crossed from DRC into Uganda, putting more pressure on border controls. WHO and Africa CDC cautioned against blanket border closures, and the bordering districts started shifting toward cross-border surveillance and regional coordination instead. Since then, WHO has commended Uganda's response, while still pressing for vigilance and cooperation.
This is Ebola Watch. ECDC's now on the ground, WHO's talking cross-border, and there's a straight answer to that CDC contradiction I've been chewing on all week. Let's start with what on the ground actually means. We'll keep tracking Uganda DRC Ebola border closure. Follow the show so the next update finds you.
From World Health Organization Regional Office for Africa.
Health ministers, emergency experts, and partners from the Democratic Republic of the Congo, Uganda, and South Sudan gathered in Kampala this week to strengthen cross-border coordination as efforts are scaled up to respond to the outbreak of Bundibugyo virus disease in the Democratic Republic of the Congo.
Health ministers from the DRC, Uganda, and South Sudan met in Kampala this week, and the district-level agreement we'd been hearing about now has an operating plan. Surveillance, lab systems, contact tracing, and community engagement, all explicitly cross-border.
Right. The border piece we've been chewing on now has ministers pushing all four of those across the line, not just signing a communiqué. The Uganda DRC plan finally has verbs attached to it.
And let's keep the strain precise. This is Bundibugyo virus, per WHO Afro, not the Zaire strain people may be picturing. That distinction matters for which vaccine and which playbook applies.
My one nag, Dr. Belizaire says, preparedness saves time. Beautiful line. A 2-day meeting in Kampala doesn't move the contact tracing coverage number by itself, though. Coordination on paper isn't a traced contact at a land crossing.
Fair. But Africa CDC and WHO getting the three neighbors in the same room is exactly the mechanism the June 16 plan called for. Whether that reaches the trader with perishable goods at the crossing is what we watch next, not today's claim. European Centre for Disease Prevention and Control writes,
The European Centre for Disease Prevention and Control, ECDC, is expanding its presence on the ground to support areas affected by the current Ebola outbreak, sending additional experts this week to increase assistance and risk assessment activities as the disease continues to impact lives in the Democratic Republic of the Congo, DRC, and Uganda.
New in the field picture today, ECDC is sending additional experts this week into DRC and Uganda, and they're not just in a capital conference room. Director Randy Wagner says they're monitoring passenger screening at the main airports, starting in DRC, then moving to Uganda.
Okay, but when they say experts monitoring screening procedures, is that EU staff actually standing at the airport, watching the temperature checks, or auditing somebody else's paperwork? Because those are very different things.
Read it precisely. They're monitoring implementation of the screening under an EU health task force. So it's oversight of a system that's supposed to already exist. And a second team with an ECDC expert is headed to South Sudan.
Right. And the honest part of Randy Wagner's own quote is that the knowledge feeds ECDC's risk assessment for Europe. This deployment is pointed back home as much as it's pointed at Butembo.
It's an EU agency doing an EU job, and I don't fault them for saying so. Pair it with the WHO Regional Office cross-border piece we just covered, and you can see real institutional widening in the same news cycle. That's convergence. Nobody should hear it as victory.
Sure, but more agencies showing up doesn't move the contact tracing number. A third actor with boots near the runway is welcome. I'm still asking whether any of it touches the gaps MSF flagged. Okay, so CDC says the risk to Americans is low, but it's also telling people not to travel to parts of DRC and Uganda. How do those two things not contradict each other?
It makes sense once you split the two warnings apart. CDC's risk to the U.S. public assessment is asking, how likely is this outbreak to spread into American communities? In the May 19 Health Alert Network advisory, CDC put that risk at low for now, largely because of screening and containment measures. The travel warning is asking a different question. If you're in an affected area, what might you personally be exposed to? And the 4-level country advisory system is State Department, not CDC. Per reporting on those advisories, DRC and Uganda were raised to level 4, do not travel, while neighboring Rwanda got level 3, reconsider travel, even though at that point no confirmed cases there were linked to the outbreak. So level 4 is about conditions for a traveler near the affected region, active transmission nearby, strained local health infrastructure. It's not a forecast for what happens when someone lands at JFK. Low domestic risk and a high travel advisory can sit side by side. One is population-level importation risk. The other is personal exposure risk in the field.
So, if someone's already in one of those countries and is flying home, what's actually happening to them at the airport?
As of May 22, per CDC guidance, U.S. citizens and nationals can still enter the country, but they go through enhanced public health screening, and they're asked to monitor themselves for Ebola symptoms for 21 days after leaving an affected country. That's the full maximum incubation window. What we're watching now is whether that screening posture holds as case counts evolve, because CDC has left the door open to adjusting entry measures depending on how the outbreak trajectory changes.
If you follow Ebola Watch for clear outbreak updates, you might also like Hantavirus Watch, daily updates on the 2026 outbreak, including the MV Hondius Andes virus cluster, CDC and WHO response, contact tracing, and traveler risk. Find it wherever you listen to podcasts. What we're watching next. A second EU Health Task Force team, including an ECDC expert, is expected to arrive in South Sudan this week to support national Ebola preparedness. You'll find links to every story we covered today in the show notes, so if one item is especially useful, you can go straight to the source there. That's Ebola Watch for today. This is a Lantern podcast.